Good afternoon, everyone. Dr. Brophy, Dr. Greg, Dr. Andrade, and Mr. Fisk. Just wanted to say welcome, and I will turn over to Chairperson, Dr. Brophy.
Yeah, so let's call the meeting of the Board of Health for 11/5/2020 to order. First item on the agenda is to approve the minutes, which are actually available on YouTube and recorded. So if I could have a motion to approve those minutes, please.
So moved.
Motion.
Second?
Second.
All in favor?
Aye.
Aye. Okay. Any opposed? Okay, the motion carries. Second item on the agenda is the Memorandum of Understanding with the Massachusetts Health Officers Association and the City of Brockton Board of Health. This is a Memorandum of Understanding for support from this organization to help us with our tobacco control procedures here in Brockton, as well as an educational program and support for the Board of Health. I believe at our last meeting, we just asked that to make sure with the city legal that there were no issues, and Dr. Mondesor, I believe there were no issues. Is that correct?
Yes, Solicitor Bridges revised it, and she said everything was okay to go.
Okay, great. So I know the board members have seen it before. Any issues on your end? Otherwise, I'd wait for a motion to move forward with the memorandum or signing of the memorandum. Any discussion from members of the board?
It looks fine and straightforward to me.
Yep, that's fine with me.
Okay. So good. A motion to move forward? To approve?
Make a motion to go forward.
Okay.
Seconded.
Okay. All in favor? Aye.
Aye.
Aye. The motion carries. Okay. Next item on the agenda is holiday celebrations within the city, including, the Halloween celebration where we followed the state guidelines. Any feedback that coming from any issues in the city during that time period? Dr. Montessor?
No, Dr. Brophy. Basically, well, we had some calls. The mayor's office had some calls. We also had some calls at the Board of Health. And in concert with the mayor, we answered them. And basically, the mayor strongly asked the people not to celebrate Halloween this season. However, if they wished to do that, they were, I'll ask her to go on outside to check for the protocol that would help them celebrate safely.
Great. Okay. Any questions from any of the members of the board?
Are we still going along with, you got holiday celebrations, we still going on with something as far as Thanksgiving and Christmas, so we'll just wait, see what's going on at that particular time?
Yeah, I think, the guidance is coming down as much as possible for, the health of your family and vulnerable members in the family is for folks to not to have large gatherings and to, to stay within the small groups of your local family. I mean, I would continue to stress exactly what's being stressed from the CDC and from the state as far as guidance, and particularly now as we're seeing the rates go up in the state, and even locally. I looked at the dashboard and we're back in the red again. I think it was in the 8% positive rate right now within the city, and I believe there's been some issues in surrounding communities as well, with some alerts going out to those surrounding communities from the state. So I think we should encourage folks in the city to follow those guidelines,
and they'll continue to be revised as everything changes. They're already kind of talking about less numbers and internal gatherings than there were before, so those will continue to be refined.
Right. So I think, as the department, just staying aware of what those guidelines are as we move closer to the Thanksgiving holiday and the Christmas holiday, and to just be consistent with the message that we give, that is consistent with what is coming down from the CDC and from the state, because clearly it's a situation right now that's changing within the state. So.
The only question I'd ask is, Dr. Montessori, are we, so given the fact Halloween is one holiday, that then Thanksgiving and the Christmas holidays, they all are very different in terms of, we've already tried this from a state standpoint to ask people to not travel, not bring your elderly family together and all those kinds of things. But the question of whether that is that's being translated down into different communities that have English as a second language is always a question. Do you know what if anything we're doing for our community around that?
Thank you. That's a great question. The city will be working with, that brings me to one of the points on the agenda for the day, basically dealing with ambassadors. That's one way we would address that, as well as some other partners or collaborators we're trying to work with. The ambassadors, we're looking at the city and the Board of Health are working together to bring in some ambassadors, basically some interns as temporary workers to do public health outreach and who would be doing health education and pass out any PPE. So hopefully we will be bringing them fairly soon. The mayor is very interested in seeing them on board. So we will be using their skills to reach out to the community with some culturally sensitive materials or linguistically sensitive materials to do education, and also the clergy and the media and some state community leaders. We're working to see how we could work together with them. In fact, over 2 weeks ago, the mayor, myself, and Dr. Herman, we had a meeting with former Mayor Moses and some Catholic priests, to address collaboration to do outreach to the Cape Verdean community. So we are working with those venues to see how we could expand. And so within that venue, we'd be addressing holidays and how people can best celebrate. Currently, yeah, sorry.
No, just asking. So, and that may include like the radio stations for those communities that are transmitted in their language, perhaps?
Yes. Dr. Herman has been invited to the Cape Verdean radio with Moses. He was supposed to go this week, and I'm not sure if he will be going. And I speak Haitian, Creole, and French also, so I'll be doing that myself, maybe with some. Probably I can do that alone. And then I can make myself understood well in English also. So I'll be working with some other with some other folks to see what other language we will need in order to spread the news.
That's all great.
That's good.
Thank you.
That's good.
Thank you.
Any other issues on that topic?
Nope.
Great.
Nope.
All right, so let's move on. Next item on the agenda are the flu clinics. I know that you have a number going for the employees as well as in the community. So maybe Dr. Montessori, you could give us an update on how things are going?
I don't know which order I should present these two. We also have 2 nurses that we are about to hire. We had 6 applicants, but 3 were qualified, and then we made a determination to retain 2, and the offer will be made between now and next week to them, and hopefully one will start this month, and the other one, because she has to give notice to her employer, probably she will come on December 1st. So that will increase our capacity to 3 nurses to be able to respond to the needs that we have, particularly with COVID. As it relates to, should I move to the next, to the other item on the agenda, or?
What's the status with the children going to school? Don't they have to have flu shots too before they ever do go to school?
Okay, well, they are still doing remote because we are in red, and so therefore a school will be 100% remote. But we continue with flu vaccine for the Board of Health continues with flu vaccine. We have vaccinated over 150 people from the city of Brockton, including some staff from the city hall, some seniors or council members in the Council on Aging, and we also did a couple of vaccination for the fire department. And then next week we have one scheduled for the police, and then afterwards. So basically, we're working to see who needs one, and I'm sure that we will have enough to meet the demand so far.
Okay. And I would also add, as you're doing your community education around COVID as well, to take that opportunity to stress the need for as many people as possible to get the flu vaccine this year, because it is so important that it's difficulty in telling COVID from the flu is difficult, and then also we want to avoid as much as possible flu also putting a stress on the healthcare system, which is being stressed already with COVID. So as much as possible, as you do your COVID education, please stress the need for folks this year to really try and, if they are eligible for flu vaccines, to get those flu vaccines and to get them as early as possible. So.
Thank you, Dr. Brophy.
Okay. Any other issue around the flu?
Nope.
No. Okay. So let's move on to the emerging red zone issue here in Brockton, and looking at the dashboard with the rise of cases that's occurring here. So we're back in the red. The schools are going remote at the moment, and strategies for moving out of it. And I also want to bring up the issue of, you brought up the issue of the nurses. We do only have one nurse, and we're talking about doing flu vaccines, but also the contact tracing that needs to happen as the cases are going up. I know during the heart of the pandemic earlier in the year that the school nurses were involved, but how quickly are these new nurses going to be brought on board? And because there is a lot of work there in the Board of Health that needs to be done, and I'm concerned about the staffing and the stress that's coming now as more and more cases in the city are developing. So.
Thank you, Dr. Brophy. The way we are addressing it right now, tomorrow at noon, the mayor is joining the Board of Health with some partners from Partners in Health, Community Tracing Collaborative, Brockton Neighborhood Health Center, to discuss a strategy moving forward to see how we can share the workload to do the contact tracing, because as you said, the numbers are astronomically high, and so therefore we're moving in the directions to make sure that we address, we do the tracing in a very effective way and timely fashion.
Yeah, no, I agree that's incredibly critical. When we have positive cases, that we know that the faster we can get in contact with them and stop, particularly in family spread, households, and make sure. And this is again where, when you're doing your community outreach with the various language and the various cultures that are involved. To really stress the importance of with family members being positive, and steps that should be taken in a household where an infected individual lives, because that is where many of the culture sort of the clusters that are occurring now are occurring in these households, and then goes on to spread beyond that. So it's really critical that we get on top of it. I'm very glad to hear that the mayor and the office is working hard on this, because it is a critical feature that we've got to get ahead of.
Yes, thank you.
Thank you. Other members of the board, any comments or questions? Or
I think just adding on to
the
that,
only
I was
thing
just wondering. Go ahead,
George.
Craig.
No, go ahead.
I was just curious as far as if you're working with the police department. I know a lot of the COVID that I found comes from a lot of these house parties with the kids, and especially since they're not in school, they have a tendency of, having parties. And I was wondering if has been working with the police department as far as them checking on, some of these house parties with, 40, 50, could even be more people involved, and that's a big spreader, especially when they go back, they have elderly people at home. I think that should be a very, very big concern.
Yeah, the mayor is working also with them, with those departments, the police and other concerned departments, because one of the things is that it takes more than just the health department to enforce
definitely
some of the regulations and ordinances.
The only thing I was going to add is that go ahead, George, keep on, sorry.
Yeah, so you are getting help from the police department and the mayor as far as, the house parties, because I can see that very critical in the city.
Yes, the mayor is
that's all
very
I wanted
active,
to know.
Yes, on this.
Go ahead, Craig.
The only thing I'd add is that part of the other challenges is that we have certain families and housing stock that doesn't allow for the necessary physical distancing, just because they're kind of large families living in small spaces and they don't have they don't have choices, which is part of the dynamic, not just of Brockton, but other cities like Brockton, because of the influx of broad spectrums of immigrant communities and families that just only have so much means. And so that's something that's a statewide and national-wide challenge, and the solutions at hand are fairly small. And so contract tracing will be a way to understand how much of it is what George has just described, house parties that are just kind of these one-off events that just cause clusters, and how much of it is poor individuals in our community that don't have a lot of choice, have to go to work, have to come back to homes where they're living in close quarters, and that creates a dynamic that is a different challenge, that is a harder one to mitigate.
Right.
Yes, that's a big one, and I think it's.
But understanding it first, having the contract tracing that lets us know what's what, is a critical element. If it's simple house parties, that's a much easier challenge than it is the kind of living description that I just gave.
Right.
Yes.
Yeah, and it's good to hear that you are looking to collaborate, get these community trackers in place, and all the proactive work that's needed to try and keep things as controlled as possible. So, for you and the mayor, appreciate the work that's being done, and I recognize until we can get the nurses on board as well, that the office is incredibly stressed at the moment, and that the support needs is being put in place, and can't happen soon enough. So thank you.
Dr. Mortisera, I'm depending on the time that meeting's happening tomorrow, I have a bunch of spaces in my calendar tomorrow. If I could be a help, I'm happy to join.
Oh, okay. Oh, thank you. I will send you. I don't think I have the Zoom yet, the link yet. Kim Sonny from the mayor's office is sending it out. So I'm going to check, and I will send it to you also. The meeting would be at 12 noon.
12 noon. Okay, that's good to know.
That's wonderful, Craig. Thanks for that offer.
Thank you.
Yeah, tomorrow's one of those weird. I mean, I had nothing but back to back today, but tomorrow has some space, and I think I have availability at noon.
Wonderful, great. It'd be great to have your expertise on that call. So, all right. Any other issues around the COVID situation in the city at the moment? Okay. So I guess the next item on the agenda is the Health Promotion and Public Health Education Partnership. I believe you brought this up already, Dr. Mansour?
Yes, I did, Dr. Brophy.
Yeah, as well as the Ambassador program coming up, which is the next item on the agenda. Do you have anything for, and also the nurses is the next item. So the next three items we've discussed already. Do you have any other comments or things that you wanted to tell us about those items?
Well, we're going to be doing some, thank you, Dr. Brophy. We're going to be doing some advertising and try to send the announcement as far as we can, because we would like to hire those temps or ambassadors in a timely fashion. And so therefore, we may need, if you have any additional places that you would like for us to go, or if you have any suggestions how to spread the news far and wide, I am open to your suggestions, please.
You know,
I would suggest, go ahead, Mary.
Go ahead, Craig.
I was just going to say that, so the challenge that we across the state and across the country have had with contact tracing, especially around certain communities of color and immigrant communities, the challenge trust with municipalities and government in general, and responding to calls or answering the door, all those things are challenging. So as you have those engagements with radio stations and things like that, kind of bringing a friendly voice that says that this is about supporting and nothing other than supporting, and know that this is about making sure families can get all the help they need, as opposed to any other kinds of concerns, is a critical thing, because the challenge around the country is that the contact tracing has been only marginally successful because there has been a challenge for people to engage.
That's an excellent point. Thank you, Dr. Andrade.
And I was going to suggest, as you advertise to get these ambassadors as well, don't overlook sort of the educational facilities that are, teaching our allied health folks at Massasoit or in our Stonehill or the other colleges around that may be able to serve as ambassadors. Or maybe willing to help out in this ambassador internship program.
Okay, thank you.
That's a great idea. I'm on the board of trustees. I bet you the mayor is able to contact the Massasoit's president to kind of reach out around that kind of thing. That message coming from him probably would make the best difference.
Right.
Thank you. I'm taking note as we speak.
Yeah. So. And also in the background in sort of the emergency plans that had been set up years ago about, when if a COVID vaccine becomes available and support help to make those things happen. I know that the Allied Health Program at Massasoit had volunteered to come forward to help with that, because they would have a number of folks that had under supervision with clinical supervisors could help with those with some of the vaccines if needed on a large scale. So I certainly would reach out and try to engage them because there definitely has been a willingness in the past to help the city, and also it's important in the. They felt it was important in their training program for their allied health staff as well. So there was good support there. So do take advantage of that.
If you need any help with contact information, don't hesitate to reach out to me. I can get you the president's email, her executive assistant, however is needed.
Okay. Thank you.
But I bet you the mayor already has that. But if not, I'm happy to help.
So. All right. Any other items that anyone on the board would care to bring up at this point? Any other questions?
I guess I'm all set.
Suggestions?
Good.
Okay. All right. So with that, the next board meeting is scheduled for Thursday, December 3rd. And as always, the agenda will be posted and the information about the meeting sent out to everyone before the meeting. So if there's no other items of business for the meeting, entertain a motion to adjourn.
Make a motion.
Moved.
All in favor?
All right.
Aye.
Aye. The meeting is adjourned. Thank you, everyone, for your time.
Yep. Take care now.
Thank you
Take
so
care.
much.
Take care
Have
and
a
stay
good weekend.
You too.
You too.
Stay
Thank
safe.
you.
Bye-bye.